So welcome, everyone. What I'm going to do is give you a little bit of a demo of clinical pathways for human trafficking. And here, as you can see, the credits go out to some of the individuals who have worked on this with me. And basically what we're going to do is we're going to look at this business case whereby someone comes into an emergency room, and that particular person, they have an issue, a physical issue. And the idea here is that in the triage, it's important to detect whether or not this person is a victim of some form of human trafficking or child sex trafficking. So the key is here to have a pathway that clinicians and other people in the emergency room can identify quickly whether or not this person is does in fact fall in that category. The way we've set this up is by first identifying the various steps involved, flow of events. We've also identified the data for each of those events. And you can see that here in this particular slide. In identifying the data, we essentially identify data categories. And from those categories, we map each category to a bioresource. So we're basically coming to the point where we move from a conceptual data model over to a logical data model. And then finally, we're able to link to the actual instance of data in the physical data model. One thing that I did not mention is that we kind of precede what I just described first by capturing some of the requirements. And those requirements in the tool that I'm about to show you, which is a tool that my software company, Visible Systems Corporation, has called Visible Analyst. It enables you to capture the requirements and qualify those requirements in terms of why, who, what, and furthermore, in terms of policies, values, goals, and other criteria. So here's a conceptual diagram. Initially, it was brought forward by actually a group of interns in a capstone project at Tufts University and Duke University. And on the right, you'll see the business process essentially that implements that conceptual diagram. And all of that information is put into the Visible Analyst. So what I'll show you right now quickly is what that actually looks like when it's inside of the Visible Analyst. So let me go ahead and click on here. And here you can see a desktop tool that enables you to depict your steps in your workflow and represent those steps in the form of a business process notation. In addition to that, the particular desktop tool allows you to set up other diagrams. For example, you have the ability to take and set up the logical data model based on whatever data is needed to support your requirements, and also whatever data is referenced alongside in the business process planning model, if you will. So let me do this. Let me just come back to the flow diagram here, and you can see these steps here. Let's see if I can move me out of the way. You can see the steps here, and the steps are basically designed to understand who's coming into the emergency room, capture some triage on that particular person, okay? And based on that triage, understand whether or not the person may be a victim of human trafficking. And if the triage shows that that is in fact the case, then what we'll do is we'll conduct a survey. The survey is launched and provided for by the Greenbaum survey itself. And in that survey, we capture more information so that we then understand whether or not, in the flow of events here, whether or not it's appropriate to recommend that that person seek more medical care or counseling, and connect the person to a network of social networks, social workers in the local area. Okay, so let me switch over for one moment, because what I want to do is I want to show you how you're able to actually see the information. Notice that all of the yellow coded symbols are business process steps in your workflow. Notice further that all of the blue coded symbols are places where there's data being stored or updated through that business process flow. And that's typically called a data object. So at each point where there's a data object, we would like to see what that data is. And that essentially is the purpose of the planning statement. So let me, by the way, once the data architect, the data analyst, systems analysts, et cetera, have modeled the situation, whatever that situation may be, then it's published to a web portal. And I'm going to show you now what that looks like. So here's a way to get started in our web portal. And to my little address here, actually down here. And here is the human trafficking demo. So we'll go right into that. And immediately you'll see two options. One option is to look at the model views in the metadata, which we just looked at but was published. And the other option is to go ahead and look at some insights. So let me first take a look. Let's take a look at some insights. And here we have a query formation tool that allows us to basically search the data that's behind our business processes and our workflow. So I did go ahead and I saved some queries here. So, for example, the initial triage, if I wanted to just understand what the data is at that moment in time, when I'm in an initial triage, I can run this query, and you can see down below the data that will be displayed relative to that particular point in the business process flow. So here we have notes, we have who's recorded the notes, and who has then reviewed and asserted those notes. Let me go back up and show you another example. Let's look at high priority patients. Here we have the names of the patients that have come into the ER, their conditions, the investigation behind their condition, some of the notes, and whether or not there was, in fact, physical evidence of some form of potential abuse or trafficking. We'll look at another one. Here's an example in our business process, which unfortunately I don't have called up. We'll go back and visit that in a moment. But here's an example of a situation where the triage has been done in the emergency room, and immediately there's a survey conducted, the Greenbaum survey. And what this data reflects is essentially what was the outcome, some very key outcomes of the triage, and also what data emerged from the survey, from the Greenbaum survey, and how those two data points are correlated. So we can see that in this particular query. And then finally, I'll just click on this one here, is the patient referrals. In this case, what we have is we have a list of patients by name, and the list essentially is a status and the focus of their status. Now, in certain cases here, you can see the status varies, corrected, registered, corrected, etc. But you can scroll through all of these, and what you're looking for really is a final status in this case that corresponds to your business process flow. And in these cases where it is, in fact, a final status on the patient, the idea is to recommend that patient to a social worker in the local area. And again, that can be another obvious query that one can formulate and conduct. So at any point in time when one is searching, or one, I should say, just querying searches, you can conduct a search, for example, on any given planning statement as we outlined, or any particular entity within a planning statement. It's a self-service tool such that you can easily go ahead and sort of click on the entities. It's a guided search process essentially, so you can get to the data very quickly. But at any point in time, if you need to refer to the data catalog or the business processes, then essentially what you can do is you can just click on model views, and what happens is your model views come up here. Okay, and and what was published for that project. And in this case, for example, you have different business rules that you can follow in helping you formulate your query. You have the planning statement outline, planning statement hierarchy. You have planning statement versus, in other words, when is a requirement referenced by any data or data source. So you have that cross-reference here. And then, of course, you also have the relationship diagrams that's based on the FHIR resources, of course. In this case, you can see an entity relationship diagram for the episode of care. So it gives you a little more insight into formulating your queries against the actual data or the instance of the data. And finally, here is your business process model that we first looked at, and you can pull that up at any point in time. And all of these, by the way, you can drill down and take a look at what the definitions are for each and every one of these. So, it's all hyperlinked through. Just my final point, and that is that you have an opportunity to share your project with anyone on your team. Okay, this is published. And enter into discussions. So you can discuss any object here in your project once that project is shared. And it could be anything. It could be on some notes that you want to discuss about a particular entity. In this case, it's the encounter entity, or it could be a reference to it here, as you see in the hyperlink here. Let's see if that works. Yeah, so here's a hyperlink back to the FHIR resource for that entity and so on. So that's my little demo for you.
Thank you, Mike. Any questions for Mike from anybody? No question? So Mike, if I'm not mistaken, this was a project that was done within a graduate student capstone project or undergraduate capstone project, was it?
Graduate students, yes, that's correct. And it was a great project. They did a great job in setting up the requirements.
Excellent.
And thank you, by the way, for coordinating all this. You did a great job on that.
Thank you. Okay.